We're learning more about the future of COVID booster shots in the U.S. Last week, the FDA and CDC formally recommended people 50 and older get a second dose. This now raising the question of just how many additional doses of vaccine we'll need. Tomorrow, the FDA advisory panel will meet to discuss just that. WCNC Charlotte's Chloe Leshner is at Novant Health in Elizabeth with more.
The conversations the FDA panel will have tomorrow will likely lay the groundwork for the future with vaccines. And while the shots were instrumental in moving us forward in the pandemic, doctors say we can't boost our way out of it. As COVID evolves, so has the vaccine schedule and definition of what being fully vaccinated is. Last week, another change, a second booster approved for older Americans. Dr. David Priest with Novant Health says for now, not everyone needs to be rushing out for an additional dose.
So while the FDA has approved the fourth dose for those ages 50 and older, my professional opinion is that the fourth dose is really most beneficial for much older patients over the age of 65 and those with significant chronic medical conditions.
Federal regulators will meet Wednesday to discuss a broader plan for a future with booster shots. But blanket recommendations may not be the answer moving forward.
The challenge for public health initiatives and CDC and FDA is in a country of 350 million people trying to put a one-size-fits-all approach to vaccination of COVID on the population really doesn't work very well. It's much more nuanced than that.
When and if younger and healthier people will need another boost is still unknown and largely dependent on future variants and possible surges.
Giving people boosters every 4 months indefinitely is not going to be the answer, and I think it's unnecessary. But the question would be, how are we going to settle in? Will COVID become seasonal? Right now, it hasn't really been seasonal. We just every few months we get a wave.
Dr. Priest anticipates that by the fall there could be an Omicron-specific booster, and that there will be some more solid guidance on how often we'll need to get the shots. In Charlotte, Chloe Leshner, WCNC Charlotte.